Today I've got 6 requests for your C-section that I bet you didn't know you could make. If you are delivering by C-section or know someone who is, stay tuned. Welcome back, my friends. Dr. Jennifer Lincoln here, board certified OBGYN, and today we're talking more about C-sections and some requests that I bet you didn't know you could make if you know you're delivering this way. And you know what? If you aren't planning on a C-section, it's still really good to know this just in case your birth ends up that way. Before I jump in, subscribe, and if you really like this content, hit the bell so that you are notified every time I put out a new YouTube. The first thing that I'm hoping you know, but I bet you don't, is that you can bring your own music. Bring a soundtrack to your birth. What do you want your baby to be born to? I have had some amazing musical choices by my patients, ranging from Beethoven to Ozzy Osbourne, and they have all been super fun. Now, if you are like, oh my, I can't, that's like another thing I have to plan, don't worry, I got you covered. Ask your OBGYN or your anesthesiologist if they can pull up some music for you. My default, if somebody has no preferences, is I'll pull up some nice calming nature music, but I will play whatever you want. Number 2, you can ask to watch your C-section. You can ask to watch the whole thing or just the part where your baby's born. And this is something good to clarify ahead of time because most hospitals have the kind of drape where it can be completely blocked and then we can drop down it and still have a clear plastic part that you can see through. But not all of them have that, but you can have that discussion with your provider ahead of time to see. And what you can ask is you can ask to watch the whole delivery. And even if that plastic see-through drape isn't available, you can ask them to position a mirror so you can watch your delivery. Or if it is available, you can ask them to keep that thing down the whole time. You might want to have a conversation with your partner to check in and see where they're at, because if they're very nauseated or prone to passing out if there's blood, you may want to figure out how you could make that request work for you. But I think it's so cool. Obviously, I do C-sections. I think the whole thing is so cool to watch. And at the very least, if you just want to see your baby being born, I think that's super beautiful. Third thing you can request, you can ask your OBGYN to leave the umbilical cord a little long so that your partner can trim it. A lot of partners like the experience of being able to cut the umbilical cord, and unfortunately, due to the sterile field, we can't have them reach over and do that while we're doing the delivery. But we can leave the cord long, and then they can later trim it up, shorten it up. And if that's something that's meaningful to them, it does not hurt to ask, and we are happy to do that. Not all partners are into the whole cord trimming thing, so if that's not your thing or your partner's jam, don't worry about it, we're totally fine. Number 4, you can ask for immediate skin to skin. Now, in many places, when you birth by C-section, the baby, we'll kind of show you your baby and then we'll walk the baby over to the warmer, and the nurses or the pediatric team will do a quick checkout on your baby and then get them over to you for skin to skin. But if you're saying, no, I want my baby right on me right away, as long as things are looking good, just like in a vaginal birth, we can do that. And we can do what we need to do for the most part while that baby is on your chest, like checking his or her vital signs, making sure that he's breathing, and assigning those APGAR scores. I will tell you, some hospitals are still behind the times with skin to skin, unfortunately. So this is a really great thing to bring up ahead of time in your prenatal visits. And you have a right to this. So if this is something your hospital doesn't offer, you have the right to ask for this. Skin to skin is a whole other topic that probably I should cover. But bottom line, if your obstetric provider balks at the idea of it, they're definitely behind the times because we know immediate skin to skin is so important for babies and for bonding. 5th thing I bet you didn't know you could request. You can ask to breastfeed your baby in the operating room while your C-section is still going on. I have had so many birthing people who have given birth, have done that skin to skin, and baby has just spontaneously latched on, or their partner or even the anesthesiologist has helped get that baby to latch on. It is not imperative. I don't want you to feel like if you don't breastfeed while your baby is in the OR that you're never going to have a successful breastfeeding journey. That is not the case at all. But if it's important to you to try, or if you just want to give your baby the opportunity to do it, absolutely you can request that. Another great thing to bring up in your prenatal visits to make sure that your whole birthing team is on your side. And the last thing I bet you didn't know that you could ask is that you can request how your incision is closed. So we generally have 2 ways to close an incision, and what I'm talking about is on the skin, not underneath that. But on the skin, we can either close the skin with staples or with stitches or sutures that are underneath the skin and dissolve away. The staples are usually removed 3 to 5 days after you deliver. And the stitches, like I said, will dissolve. There have been so many studies, and every study contradicts the prior study in terms of outcome and how they look and patient preference and surgeon preference. So there's no huge difference in healing, but it's up to you. Now, if your surgeon says, I do staples and here's why, and in your case, I really recommend them, then you might want to stick with that. Or if your surgeon says, I never use staples, and here's why. I mean, of course, as surgeons, we have our preference, and it is oftentimes good to go with the thing that your provider is most comfortable with, because it means that's the technique they're the best at. And whatever they're the best at is going to give you the best outcome, usually. But if your provider is like, whatever you want, let us know. And again, something to bring up in your prenatal visits if you know you're delivering by C-section, because the last thing you want to do is, you're holding your baby, you've just given birth, and you're trying to answer these questions and make decisions. It's, kind of a hard time to be thinking of all those things. So it's something that you can talk about ahead of time. And this is why having a birth plan or birth preferences are not just for vaginal births. They're for C-sections too. Maybe that's another topic I should cover. Okay, those are all my insider tips of things that you can request during a C-section. Which one did I leave out? Which one would you wish you had known about requesting? Go ahead and drop it in the comments, and I'll either feature it in another social media post or another YouTube. All right, everybody, stay safe out there. Bye-bye.